If you had ACL reconstruction surgery, when will that ACL leg be the same strength as that uninjured leg? We're going to break this down based on research and our expertise. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So let's jump into it, guys. So if you had ACL reconstruction surgery and now you're going through the process and hopefully you've been getting tested, and we'll talk about that. When do you find out, or when is that right time to specifically say like, hey, my leg should be as strong as the other leg? Or will it ever happen? So let's break this down. So whenever you have ACL reconstruction surgery, one of the big measurements to make sure you have a good outcome and go back to sport, one of the most basic ones is quad strength. And the quad strength gets tested in a couple ways. One that you mostly see in the clinic is that you're sitting down and you're kicking out against a device that measures force, and you want to compare that with your uninjured leg. Ideally, best case scenario, you test your uninjured leg before you have surgery so you can see a good marker. And that's going to be our limb symmetry index. So whatever number you have on that uninjured leg, that's going to be your standard. And whatever you have on the injured leg, that's going to be the percentage. So let's just throw it in simpler forms. So if you kick out and in the left one, you get 100 newtons of force. On the right one, you're at 70 newtons of force. So you're at 70% limb symmetry index compared to that left leg. So that's a percentage that we're going to use when we talk about the different cases on when it comes to rehab. So now that you guys know that, let's break down what our main goals are throughout the rehab. So early on in the first 3 months, we're really working on range of motion, getting our base strength little by little. But at the end of 3 to 4 months, we should be around that 70%. Ideally, if everything's sitting right, 60 to 70%. As those months go on, more that's months 6 to 8 months, really working on getting stronger, really working on power production, getting in there. Now we go into more of that 80%, 90%, and then ideally after 9 months, after 10 months, even longer, we want 90 plus. And around 12 to 18 months, that's when we want 100% ideally. So it's going to take some time to get that strength. And there's other little setbacks that could happen or factors that might change these months. So sometimes people have, they don't just have an ACL reconstruction surgery, they have a meniscus repair. So when you have the meniscus repair, you're not able to really load that knee early on. So that's going to push these numbers a little bit further out. Or let's say you just have like a freak accident and you have another injury while you have your ACL. Not a big injury, but a little minor tweak. That pushes those numbers out. Or if you just had a lot of swelling early on or an infection, there's other little factors. So we can't really give concrete details, but normally we want to be in those 12 to 18 months where we're at 100% compared to our uninjured leg. And when it comes to that, how do we get there? So the big thing is you absolutely have to be doing unilateral training when it comes to the ACL rehab. And that's like lunges, single leg RDL, single leg squats. You still want to have your base foundation of two-legged movements, but we really put an emphasis on single leg movements, single leg jumps, single leg strengthening in different planes of motion, because we want to make sure you're not compensating. So if I do a bilateral squat and I keep going up in weight and then I find out that my left leg is just still much stronger than my right, that's why I need to add, single leg squats on one side. And you could see your strength progress, because let's say you're doing a single leg squat with 10 pounds on the left, and the right you can only do it with 5 pounds, and then you slowly catch up. And that's when you start building up that single leg strength. And one of the questions we get asked is, and it's a very common question, and they have the right to say, is like, if I'm training unilaterally, my left leg, my uninjured leg will get super strong. How will my right leg ever catch up? And we kind of tell them like, hey, we're just going to go back to our timelines. Our big things that we want to oversee is we want to see you progressively catching up and getting that gap smaller and smaller as you progress. You still have time. I tell a lot of people you want to get in that 100% strength around those 12 to 18 months, even earlier if possible, but it's going to take some time. And that's a good thing, because we really want to use that left leg. Because it's getting stronger, it's a true marker. A lot of the times during rehab, that left leg will get weaker early on because you're not as active. So the measurement of the left leg early on is not as accurate. So we want to make sure as we're strengthening the left leg, we're updating that score. Like I said, best case scenario, you find, the measurements before you have surgery, right after, you test your left one, that we could really use that as a baseline. Or if you guys have database systems like we do, we have based on your age, what sport you play in. We've seen hundreds of athletes that we know what kind of range you want to be at. And that way you can see where you're stacking up. And when it comes to strength, guys, a lot of times the actual physical appearance might be off. So you might still see your right leg look smaller than your left. However, when you test it, it's the same strength. So that's the most important thing. Even though the size might not be the same, as long as the strength, that's totally normal, unless there's a huge difference. Let's say in one leg it looks like a stick, the other one's like a tree trunk, then there's a little thing that we want to make into. But a lot of the times when it comes to actual physical size of the leg, a lot of things that play a role are the actual nutrition and other little factors. But one big key tip that I usually tell people when it comes to trying to mitigate that difference is just adding in simple little exercises to increase that volume on the right side. One thing we like to do is finishing the session when we do single leg stuff with some blood flow restriction training on the athlete on one leg as a burnout, just to get increased volume while minimizing the stress. And you'll see people's actual size also increase because it really drives hypertrophy. But that's kind of the overview when it comes to ACL, how long it takes. It's usually going to take around those 12 to 18 months to really get that leg looking and being as strong as that other leg. But you want to make sure you're hitting your timelines, really getting those, always testing at, normally we like to test at every 3 to 2 months intervals, sometimes even 1 month intervals after the 3 months, but really tracking your strength. And the way you track it is by objective measurements, going to physical therapists that have these testing tools so you can kind of keep track of how well you do. The way you, let's say if you compare with just doing lunges on left side versus right side, you'll never have the true number there. And when it comes to unilateral training, it's an absolute must. You have to really get those muscles stronger unilaterally, and then really just have like a foundation of double leg, but really go harder on the unilateral. But hopefully you guys like this video when it comes to finding out how long it's going to take for you to get back to the other leg strength. So like I mentioned, strength will come before size, and just let it take its course and really work on unilateral strength and add in some blood flow restriction training. But if you guys have any questions, comment below. Let us know what you guys think about the video. Share this with friends and family. Like this channel. And also just follow our videos. And if you guys have any questions, send us an email. We work with people in Southern California and also online. We are the Basketball Doctors. Let's ball for life.